In the past, we've seen predominantly healthcare being a fee-for-service, and now we're starting to see more around preventive care and payment on performance. So it's really changing the dynamics of healthcare organizations. It's having them really rethink how they're going to market, their business strategy, their operations, their business models. So that's really transforming this industry at a very rapid pace. We're seeing the cost being such a major component of these dynamics that organizations are having to really take the costs out of the system. And they're seeing across both the business and clinical areas that Oracle can provide some very strong capability across this finance, supply chain, human capital areas that really help identify where the issues are and help to identify where the costs can be taken out of the system. Business intelligence is probably the one area that we're seeing from an analytical perspective organizations struggle the most, and large organizations primarily. We see large organizations using metrics and reporting and analytics in very different ways, even within the same organization. So what we're using business intelligence to do is drive common standard set of reporting that management can use to better manage the business, understand and be more proactive around decision making and issues. And that's really been a driver for most organizations today, blending not only the core capabilities around analytics from a finance perspective, but also around clinical and operations so that they have a blend and a view to that. PwC has actually developed a healthcare analytics dashboard that's taken all those measures together and built that based on the Oracle product suite that we're now able to take to market, which gives them that whole holistic picture of the organization. I think from an information perspective on business intelligence, having better information to make decisions certainly can improve care, but it's more specifically an example around supply chain. Making sure we've got the right products and the right supplies on the patient floors at the right time is absolutely crucial, or to the OR, for example. So we don't have to cancel surgeries, or we don't have to miss certain things or have the wrong product or wrong diagnosis. So by having that information more readily available, it's going to directly impact patient care. We're at a client right now that is one of the leading, if not the leading, healthcare organizations in the country, and in some cases the world. They are very advanced in terms of what they're doing from a medicine and truly leading a lot of the organizations. But from a standpoint of the information that they have available to make decisions today, completely different story. They don't have the information that's available to them today. They don't have information to make decisions. They don't have information to help drive costs down. So one of the things that we're doing is really helping them through that process. And so from a standpoint of providing a leading client, truly a marquee client with our best team is very exciting.